Hi guys, welcome to my channel. My name's Katie and today I'm going to be talking to you about my 20-week pregnancy update. So I just went to my 20-week appointment, and this appointment is kind of a big deal. If you've been pregnant before, you might know what I'm talking about because it's the appointment where they do the biggest ultrasound of your pregnancy. They measure the heart, they measure the brain, they measure all of the arms, the legs, the hands, and just make sure that everything is okay with your baby. And it's a little bit nerve-wracking because you just never know what they're going to tell you. So basically this appointment is really important. This is also the appointment where you can find out what the gender of the baby is, but we actually found out the gender of our baby a couple of weeks ago. We couldn't wait and we went to one of the gender peak places and found out that the baby was a boy. And during that ultrasound, the ultrasound tech there was just kind of doing like a general look of the baby, and she said we don't go in depth, but everything looks okay. The heart rate was normal, and like from a basic glance the baby looked really good. So honestly, I mean, I was nervous going into this appointment, but not that nervous because I was thinking that everything would be fine. So we got to the appointment and I had my ultrasound first. So they did my weight, took me back, and started doing the ultrasound. And while the ultrasound tech was doing all of the measurements, I had a pretty good idea of where she was looking on the baby because I've had a few children already. I've been to several ultrasounds. I'm also a nurse and I've just looked at ultrasounds quite a lot, so I can generally tell what they're looking at. I don't have all of the measurements memorized or what everything should be or anything like that, but I could tell obviously when she's measuring the brain, measuring the heart, measuring the arms, and it seemed to me like she was spending quite a lot of time on the heart and like trying to get a whole bunch of different angles. And I specifically asked her while she was doing this, and I said, is everything okay? And she said, yeah, everything looks really good. We just like to get several different angles of the heart, and that's what I'm doing. So I went along with that, and she moved on throughout the ultrasound, didn't mention anything. And I then noticed that she was spending quite a lot of time in the bladder kidney region of the baby, which I sort of thought was strange. I just didn't remember that with my previous pregnancies, but it has been a little while and I thought, well, maybe I don't really fully remember that. So we finished up with the ultrasound and I had my kids with me, my husband, and it was just kind of a chaotic mess. So we went into a room to wait for the actual doctor. All three of my kids and my husband and I, and the kids at this point were just, they had enough. Like the ultrasound took a good amount of time to get all the measurements. They were sick of waiting. So we probably waited in that room for a half an hour. The doctor still wasn't there. So I told my husband, just go ahead and take the kids. Like, I'll just stay here. I didn't think anything would be wrong. So I knew the kids were hungry and I was like, just go ahead and get them something to eat. I'll be fine. And the doctor came in and the first thing that she talked to me about was my dates. And she said that my dates were actually, the baby was measuring 3 days ahead, and she said she's not going to be changing my dates though. She's going to leave them where they are, and that the baby looked really good. And she just was talking to me about scheduling my C-section because I've had 2 previous C-sections and I'm going to have a C-section with this baby just because of my past history. So all of that was normal. And then she said that they detected a potential Down syndrome marker with the baby. So how she explained this to me was, okay, you've got your kidneys, and then basically the kidneys filter down into the ureter, and the area where they filter into was slightly enlarged. And this is called renal pyelctasis. I might not be saying that 100% correctly, so pardon me if I'm not. And this is a soft marker for Down syndrome. And I just was not expecting that, but at the same time I was like, okay, I know what a soft marker is. I'm not overly concerned. And then she went on to tell me that my baby's where she was measuring should be 4 millimeters around there, and my baby's was 5 millimeters, so slightly above what it should be. And she said that this isn't like anything that I should be immediately concerned about. She said that she wanted to retest or do a repeat ultrasound when I was 28 weeks. And if the area was still enlarged, then she wanted me to see a pediatric urologist and do an ultrasound there, because if that area continued to be enlarged, there was a chance that the baby may need a small stent placed in the area to help the urine flow after birth. But she said in most cases it does work itself out by the 3rd trimester, and that if it doesn't in the 3rd trimester, a lot of babies, after they pee a couple of times once they're born, and then it works itself out that way. But still, I hadn't had any of the genetic screening or tests, or I hadn't done the panoramic blood work. I never do that with any of my pregnancies. It's just not something that I do. Since I hadn't had that screening, I really had no idea what the possibility of this was. And my husband wasn't in there with me, so I knew that I was going to have to relay that information to him. And my doctor was like, you don't have to decide right now if you want the panorama or not. If you want to wait until the 28-week ultrasound to see what happens then and go from there, we can do that. And I told her that's what I wanted to do. And I said, I'm not going to overthink this. You know, obviously there's nothing I can do at this point, and basically it is what it is. I'm going to love my baby no matter what. This world is already so hard, and I don't want it to be any harder for my child than what it needs to be. So it was, I don't know, I don't feel like it hit me right in the doctor's office, but then I walked out of the doctor's office and walked to the car and told my husband, and he was like, what? And it's just, I did not want to tell him. I mean, it's so hard to tell someone, like, even if it is your husband, like, the baby isn't perfect. It's hard to say that something is wrong, and it's not what I want to say. It's not what he wants to hear. And it's been a really hard day, and it's going to be a really long wait to get the next ultrasound. And I'm not going to do the panoramic testing at this point. I'm just going to wait to see what happens at 28 weeks. And I truly believe that this baby is okay. Like, everything in me is telling me the baby's okay. My doctor said, she said, honestly, if I was in your position, that's what I would do. She said, I would be honest with you, I don't have any concerns right now. Everything else measured perfectly. There were no other markers. At this point, honestly, I just kind of feel like helpless to the situation, and I am just going to try to relieve my stress as much as possible. I don't know. Sometimes recording videos helps, because if anyone else eventually goes through this, I don't want you to feel alone. I just feel right now like I don't know anyone who has been through this. I had a little bit of a crying spell because I don't really want to tell anyone, because I don't want to scare anyone, because I don't know for sure if there's reason to be concerned yet. It's just a hard place to be in. So I'm not really sure if I'm going to post this video until I know for sure what's going on. I haven't made up my mind, but I wanted to be honest and get my feelings out there on how all of this is going. Other than that, baby boy is very healthy. His heart looks amazing. His heartbeat was 155. So everything else looks great. So just know, if you're going through this, you're not alone. Be strong, everything will work out, and I'll talk to you guys soon. Bye. Hey guys, so today is July the 18th, and I have some really awesome news. I just got done with my appointment for my little boy, and I'm 28 weeks right now, and everything is normal. So the last time I went into the doctor's office, I was 20 weeks, and that's when I shared that information with you guys, and they wanted to do a repeat ultrasound at 28 weeks. So I went in and I had my ultrasound first, and they spent quite a lot of time looking at his kidneys and looking all over. And my regular OB doctor is actually out right now on maternity leave herself, so I saw a doctor that I'd never seen before, after the ultrasound, and she listened to the baby's heartbeat. The baby's heartbeat was 143, which is normal. And then she said, okay, are you having any problems? And I said, well, what about the kidneys? Like, is anything going on? And she said, oh, I don't know. I don't have that paperwork with me. So I was like, okay. I mean, because in my mind, that was the whole point of having a repeat ultrasound. But she went out and got the paperwork and came back into the room, and she looked over everything, and she said that the kidneys are totally normal. And I said, well, when I was in last time, they said that he had renal pyelctasis, and that was why I was having this ultrasound, to recheck that, and that was a soft marker for Down syndrome, and that I was just following up because it was pretty concerning, and I wanted to know what she thought about all of that. And she said that yes, it is a soft marker, but she said in a true Down syndrome situation, there would be other things going on with the baby as well. And she said there was nothing at all going on, but I don't know. That's why I'm kind of making this video, in case anything like this happens to someone else, because the first time I went in, they made it sound like they didn't think anything was wrong, but that there could be something wrong. And then this time when I went in, they made it seem like unless there's more going on than just the renal pyelctasis, then you should be fine. Anyway, basically it cleared up on its own. Both of his kidneys are the exact same size, are the exact size that they need to be, and they're functioning properly, which is amazing news. And I'm just so relieved. I haven't talked about this to anyone because I didn't want to scare anyone before I knew anything, and I'm pretty glad that I didn't at this point, because everything worked out. So hopefully this just gives you some hope and peace of mind if you're going through this as well, because I didn't really have any information on it, and it was hard to find any videos like this on the internet. And I just wanted to share my experience with you guys. So hope you're all doing well, and I'll talk to you in my next one. Bye guys.